The heart is a hollow muscular organ that functions as a pump. It pumps blood to all the cells in the body. For the heart muscle to function properly, it needs fuel. That fuel is supplied by blood that comes out of the aorta into the coronary arteries, which then branch into the heart muscle, also known as myocardium. Disease of the coronary arteries has long been the leading cause of death in the United States. Coronary artery disease is the end result of the accumulation of plaque within the walls of coronary arteries. This accumulation causes a chronic inflammatory response called atherosclerosis that narrows the arteries. At rest, the narrowed arteries may provide adequate blood flow. However, we know that an increase in stress or physical activity causes an increase in heart rate and increased oxygen demand by the heart. With a constricted pathway, the increased demand is not met by a proportional increase in blood flow, and the amount of oxygen supplied to the myocardium is inadequate to supply the needs of the tissue. This is called ischemia. When a myocardium becomes ischemic, it does not function optimally, and when large areas become affected, there can be impairment in the relaxation and contraction of the myocardium. Angina pectoris is the chest pain that occurs from myocardial ischemia. If the blood flow to the tissue is improved, such as when a patient uses a vasodilator like nitroglycerin, myocardial ischemia can be reversed and the associated angina relieved. Two common acute coronary syndromes associated with coronary artery disease are angina pectoris and myocardial infarction. The patient who has an acute anginal episode will typically describe it as tightness, heaviness, or a constricting feeling in the chest. In fact, frequently the anginal victim will make a fist and hold it against their chest to illustrate what they are feeling. Generally, these patients will have a pre-existing history and they know it's an anginal attack. Dr. Larry Prince of Tulsa, Oklahoma can tell us about this.
Recognition of the problem was pretty easy. The patient gave us a history of angina. As a result of that, we asked him to bring in his medication, his nitroglycerin. During the procedure, he stopped us and told us he had an angina attack coming.
Anginal attack.
We followed the usual PABCD algorithm. The patient wanted to sit up and we allowed him to do that.
Sorry,
That's okay.
it happens from time to time.
He medicated himself.
Greg, why don't you go ahead and get the emergency medical kit and the oxygen? If you'll look in the kit and get the nitroglycerin spray out, just set it back on the counter. How do you feel? Starting to feel a little better?
Yeah.
We had our nitroglycerin spray and oxygen available, but the chest pains dissipated.
Yeah, that's what. Sorry, I never know when it's gonna come.
Well,
don't talk about it.
Maybe I mentioned the gas price.
Yeah, that's what.
I probably wouldn't have done very much differently, except been a little more observant for the signs of dental fear or anxiety. If I had noticed some fear or anxiety, then I probably would have used sedation, oral or inhalation or IV. All in all, I thought the staff was well prepared and we handled the problem efficiently.
Do you think you'd like to go ahead with treatment today, or would you like us to schedule back next week?
Oh, I'm here. Let's get her done.
Well, you sure?
Sure, yeah.
All right, we'll go ahead. Let's go ahead and we'll continue with the treatment, Greg.
Whew.
We'll take a couple more minutes.
I'm good.
Okay.
If an anginal patient takes 3 doses of nitroglycerin at 5-minute intervals, and their pain continues, worsens, or subsides for a short period, then returns, you must consider that this patient might be experiencing acute myocardial infarction and not an anginal attack. Also, if a patient comes in with no prior history and has chest pain, you must manage the situation as though it was an acute myocardial infarction until proven otherwise. In any of these situations, the very first thing to do is to activate emergency medical services.